Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village. I'm also co-host on the show It's About You on WKYC Channel 3, where weekly we recognize people that are everyday champions doing great things in our community. However, this web series is about your health. Yes, it's about you. And so during this web series, we wanted to talk about being a better person, being a healthier person. And I thought that even during this pandemic and all the things that were going on, I felt compelled to make sure that you have the latest information in all areas of health. And so that's why I'm pleased to be partnering with university hospitals in spreading the word in our community about how, again, you can be a healthier you. And so today I'm speaking with Dr. Wendy Cole. She's a podiatrist for university hospitals, and I'm just so glad to have her here on this segment. How are you, Dr. Cole?
I'm good. Thank you. Thanks for having me, Pastor Larry. I appreciate it.
No problem. So tell us what we're going to talk about today.
Well, we're going to talk a little bit about lower extremity wounds and when you should seek care and why you should seek care and the care we can provide through university hospitals, particularly at Richmond Medical Center. We have a wound care center there. So we'll talk a little bit about what services we can provide.
Got you. Well, I love that. And I know there's a particular lower extremity challenge that a lot of people have, and we talk about it. It's characterized as a foot ulcer. So tell us a little bit about that.
Well, patients that can develop ulcers or sores, so any break in the skin, any open area that drains, either bleeds or other drainage, we consider that an ulcer. Diabetic patients, unfortunately, are more prone to these ulcers, and they can lead to complications that can decrease quality of life, have hospitalizations, need antibiotic therapy. So we want to prevent, and we want to really treat these aggressively to prevent patients from having problems with ulcerations.
Wow. Now there's a diabetic foot ulcer. So tell us about that.
So patients with diabetes have a couple concerns that lead to the development of ulceration. So typically a diabetic, so a person with poor glucose control, so they have high blood sugar, that will lead to deterioration of the nerve fibers. So patients feel when they've had an injury. So I've seen patients walk down blacktop driveways. I've seen patients step on glass or step on a toothpick or a poor fitting shoe, and that shoe rubs certain areas. And all of these things can develop those open sores that we call diabetic foot ulcers. So we really want to educate these patients. We want good glucose control. We want them to check their feet regularly, and we want them to seek preventative care so that they don't develop these ulcerations on their feet.
And I was wondering, why is this so important? I mean, sometimes somebody just steps on something, they think, well, it'll heal up or it'll just go away. Why is this important to really take care of quickly?
Well, again, especially in diabetics, they can have poor circulation. They have something called microvascular disease. So the small little vessels that we find in our hands and particularly in our feet may not be pumping the blood to the area. So they have difficulty healing because of that. They also have increased pressures on their feet, again, that lack of sensation, and then they're a bit immunocompromised. So when they get an infection, their body can't rally the white blood cells and kind of fight that off like someone without diabetes can. So that's kind of like the perfect storm to develop infections. Infections could develop abscesses that patients need antibiotics, hospitalization, or even the need for surgery. And we know that patient outcomes decrease the more severe an infection can be. So we want to catch these things early and prevent infections from occurring, especially in that patient population.
That makes a lot of sense. So how does your team kind of manage this? What is kind of the process that a person would go through?
Well, we have a great team at University Hospitals Richmond Heights. We have a dedicated wound care center where we patients for any condition. Now, I'm a podiatrist, so again, I treat lower extremity ulcerations on the legs and on the feet, but we have plastic surgeons and we have other practitioners that can treat ulcers, from the knee up as well. So we have a comprehensive team that evaluates patients. We will make appointments to the appropriate practitioner. We know how to evaluate these wounds, and we could best determine the treatment plan for the patient so we can get them to heal up as quickly as possible and get back to their normal routines and normal life.
Well, that's the plan. So what are some of the treatments that you offer, Dr. Cole?
So we have advanced wound dressings. So some are antimicrobial to get rid of bacteria, again, to prevent infection. We have special offloading devices on the bottoms of the feet to kind of protect and prevent and allow these wounds to heal up quickly. We can do a lot of screening tests, vascular assessments, special devices that can look for bacteria and contamination in the wounds. So there's a whole host of things that we have in our wound care center to help diagnose and treat and really track wound progress.
Well, that's very helpful. And so my last question is, how do you prevent these foot problems? What are some things that people can do so they don't have to go through any of this?
Right. Well, patient education is key. You want to make certain that diabetics are checking their blood sugar and checking it often. Just because you're not checking it doesn't mean your blood sugar is within normal range, and you need to take your medications as your physician prescribes them, but also regular foot checks. So a lot of patients will develop ulcers on the bottoms of their feet. Sometimes it's difficult for patients to really look on the bottoms of their feet to check if there's any sores or cracks or areas of concern. So if you have someone that lives in your household with you, you can ask them to check your feet, or you can put a mirror on the floor and check your feet that way. You want to also look in between your toes too, because that's an area where bacteria and problems can harbor. And then, regular podiatric care, nail care, callus care, those sort of things with a podiatric physician can really help to prevent these problems from occurring. And proper fitting shoe gear too, that's key. A lot of patients will have structural abnormalities like bunions or hammer toes. If you have shoes that don't fit properly, those areas can rub, and that can lead to problems as well.
Gotcha. So wear quality shoes that fit your feet.
Yes.
I like that. Then you prevent all these problems that are going on. Well, Dr.
It's about function and not fashion. So
okay.
it's hard to get them to realize.
I would say that's going to be a very hard one for a lot of people, but that is some great advice. That's some great advice. Well, thank you, Dr. Wendy Cole, so much for all this information. Thank you for being on this segment.
Thank you. Thanks for having me. Nice talking to you.
Nice talking to you too. And I just want to thank all of our viewers for tuning in and watching us, and for University Hospitals for this great partnership where we're able to let you know how to be a healthier you. Remember, you can contact me on social media or go to my website, LarryMaconJr.com. But if you need special care, go to University Hospitals, check online, get scheduled, and get to a doctor so that they can help you out. A doctor just like Dr. Cole, who is very willing to work on you and make sure that you feel better. Again, thank you for investing in yourself by watching this video. This segment, again, is called A Healthier You, and we'll see you on the next episode.